Okay. So I just want to talk a little bit about today of introducing payment plans with patients in a way that might feel a bit more natural and doesn't feel like a sales pitch to the patient. So if you see a patient, especially a new one, needs a payment plan, in order for them to accept treatment, you may find that you might offend them if you bring it up, especially if you don't bring it up in a kind of like sort of like in an about way. So this possibly might create a negative situation, and it will kind of cause like a negative kind of like rapport with the patient. So what we want to try and do, and what I think is really important, is one, establish whether you think the patient will probably need a payment plan, and two, to introduce it in an ideal payment plan in the best way that you possibly can. So what I find is probably the most important is really try, like I said before, is try and work out if the patient does need a treatment plan, and how do you do that without sort of like bringing it up or talking about a payment plan when you first talk to them. So introducing the fact that the payment plan is available, I think this starts even before you see the patient. So the first one would be a welcome pack. So if your practice is already doing a welcome pack, when you send it out, as part of the spiel at the end, you could say, look, we do offer payment plans for patients, and we have, this payment plan, whichever one the dentist wants to use. But doing that, even before the patient rocks up to your surgery, you know that there is a payment plan. And so if that's something that the patient thinks they're going to want, once you tell them how much the treatment's going to cost, they'll bring it up rather than you bring it up. And so I think that's the best way. Secondly, you can have brochures in the waiting room, but I find that gets a little bit cluttered, and a brochure is just a little thing in the waiting room. It's not, a patient still needs to go and pick it up and so forth, but it's still good to have it if you can place it in the right area. Thirdly, and this is what I do in my practice, I have a TV screen where I give information to the patients. I make it very interactive, so we'll have questions on there. We'll have before and afters, and on there we'll have one page that says we do payment plans. And if you're interested, please ask the dentist. So again, everything is geared up to try and get the patient to ask us about a payment plan if they think they want it, rather than us having to say that to try and get them over the line to do treatment. Because I think that always sets you up for a possible negative outcome. And then introducing the payment plan, to a patient in the treatment room. I think in this case, it's also very, very important that you have done it in a way which I do it in a prime way. So for those of you who may have used prime practice, you'll understand what I mean. And for those that that haven't used it, I might give you a little bit of a rundown on how we do it from a prime perspective, which again tries to give you 100% kind of success rate in your treatment plan, rather than get a negative outcome or feel like a sales pitch at the end of that consult. So in talking about introducing the payment plan to the patient, so I'm going to base this as though we're talking about a new patient, which is obviously more difficult than one you've already got a relationship with. And so I want to divide that first visit with the new patient into 3 stages: preclinical, clinical, and consult. So preclinical is where we must establish whether you think the payment plan is something that the patient's going to want. And so it's really, really important in this situation, I think, to try and establish that is to do 3 things. Number one, you have to build rapport. So like many of you already would do, you meet the patient for the first time and you talk to them a little bit, try and gain a little bit of commonality, connection, and build that rapport with the patient. Secondly, you need to build trust. So in building trust, obviously everyone's got their way of doing it, but it is definitely really, really important before you start talking anything about money and treatment, that you do those 2 things. And thirdly, which I think is the most important, is educating the patient. Now, in the prime way, we do a lot of education of the patient prior even to meeting them. So, and this is really, really important, especially for my practice, and in order to do it in a way that I think you get closer to 100% success rate rather than, say, 80, which I think is probably what most dentists will probably find. If you look at it properly, that's what you achieve. So I think it's really imperative in doing this, that you speak to them in the third person and not about them. So that way it doesn't make them feel like you're directly talking about their mouth, but you're still giving them all of that information prior to it. So a phrase, a lot of the times what we do is we will gather a telephone slip, get the information about a little bit about their dental history prior to seeing them, so that I know the things that I would like to educate them about prior to it. So, for example, if my front girl takes the information and says, and in that she gets this information from me, that the patient's got some missing teeth, she's got a lot of amalgam fillings which are old, and they've even broken a tooth, then I know that I want to talk to them about amalgam. I know I want to talk to them potentially about implants and or bridges. But I want to talk to them. I know what I want to base my preclinical exam or preclinical discussion about, so I guide them to that. And that way, I'm educating them even before I look in their mouth, so they feel it's I'm talking about people in general. Okay, so I think that's really, really important. And then once you've done that, I think it's always good to try and gauge where the patient stands economically. Because that way it will guide you also to before you look in the mouth, and then also to when you do your final consult, is to what do you think that patient can afford. And so I generally will do something like a common phrase like this. I'd say, look, it's not uncommon for patients who have got missing teeth and need maybe some crowns to spend X amount of dollars. So let's say it's $10,000. I'll always like to make it a little bit more than I've already kind of gathered it might be. So if I think they're going to spend, $6,000 or $8,000 in their mouth, because I think they might need 3 crowns and maybe an implant, I'll say that it's going to cost 10. So that way, when I get to the end, it's going to be cheaper than what I've already kind of told them up front. So always do like one of those statements, like it's not uncommon, for people these days to spend, X amount of dollars, because dentistry's come a long way. But hopefully when I look in your mouth, a lot of those fillings that, got the silver ones that maybe are not so big and, are still in good condition, so we might not have to do anything. So that's one thing I think. Now, by doing that, if I say to someone, it's not uncommon for someone to spend $10,000, at that point, if that person really is uneconomical, they're going to go, oh, wow, there's no way I can spend that. Or if I've done my job correctly and, I've educated them in that preclinical discussion enough, then if I find that they don't react to it, then I know that more than likely they won't need a payment plan. So if they've reacted in a way, like I said, oh no, so look, doc, I can't afford that. Then at that point I might say, look, don't worry about it. Look, let's have a look in your mouth, because hopefully, you won't have any of those things to do, and it might be a lot less than what I'm saying. But then I know that that's something I will probably more than want to bring up. Let's say they need 1 crown. I may then go at the consult stage, look, you need this, and I show them. And look, we do look, and if it is a little bit hard for you to pay it all, pay it all at once, we do have payment plan options. So that's what I mean by, dropping that kind of phrase to go, it's not uncommon. Other people do this. Therefore, if other people are doing it, then it means that I should probably be, it's okay for me to do it. And always talk in the third person. I think that's really important. So second stage is clinical. So when you do your clinical exam, I never talk about money at that point. So I wouldn't bring in talking about payment plans. And then the third phase is consult phase. So because you've already primed the patient, okay, in that preclinical exam, if they need a payment plan, more than likely, they're going to ask you. So for example, if I've deepened enough concern to say that, what we find with patients, and this is all again in the preclinical exam, what we find with patients is that if they've got, big amalgam fillings that are more than, say, 60% of the tooth, they tend to fracture and they cause cracks in teeth. And often these people are the ones that tend to have, we recommend crowns with. And that's because we want to make sure that those cracks don't go worse or crack the teeth, in which case you may even lose the tooth. So we're deepening concern about what they possibly have in their mouth. So if I've done that well enough, then when I get to the consult phase, they're going to, and I say to them, look, and you've got a tooth that's 90% amalgam, and it's got all these cracks, and I can show them on the screen that there's cracks. I've already deepened concern enough for them to tell me that they want it. And if they want it and they can afford it, everything's cool. But if they want it and they can't afford to pay all of it at once I tell them the cost, they will be saying to me, oh, look, doc, could I pay this off? So that's why I think the or the education in that preclinical stage is really, really important, because I find that I don't have to sell them anything if I've done that well at that last consult phase, which should only take me a very small amount of time. So let's say that if I then establish here they need a treatment plan, that they need to pay it off and they want to do a payment plan, which one would I choose? Now, look, I've used a lot in the past, from GE to some others, but GE probably in WA. I'm not sure what they use in Sydney and Melbourne. But in the last, say, year, I've used Zip. And the reason I use Zip is because, for me, I like to be able to provide something to my patient that's not going to cost them extra. And so with Zip, they do offer a 6-month payment plan, a 6-month interest-free payment plan. So for me, that works really well. My patients don't pay extra. They don't feel like I'm trying to sell them something that is now going to cost them more than what I already said. And for me, it works really well because, it costs me 4%, so that I feel that that's pretty reasonable. And my front desk have very little work to do. It usually, before we used to have to do paperwork and wait for that to get back. This is approved in 3 minutes, and often most of my patients make the decision still while they're there. And so for me, that's good. They get booked in, and so everything runs really smoothly, and it's approved within about 3 to 5 minutes. So overall, like I said, we don't, in WA now, with the economy the way it is, people wanting to do payment plans or pay their treatment off has become a little bit more common. And so I did look into the payment plans that are available, and like I said, for those reasons, I've chosen Zip. It works really well in my practice, and yeah, so I've been really happy with it.